Asthma remains one of the silent non-communicable disease killers. Global statistics by the World Health Organization indicate that it claims 250,000 lives annually. A survey conducted by a team of medics in Mulago indicates that in Central Region, asthma cases are on the rise among primary school children, with 17 cases registered in every 100 pupils screened, a trend that is worrying health workers.
Some studies that indicate up to 12% of children between 8 years and 14 years in our schools around Kampala have asthma. That is 1 in 7. So that is quite common. And all over the world, there's an increasing trend of asthma, particularly in developing countries.
But what could be the cause of this non-communicable disease?
It could be related to the increased number of motor vehicles, the modernization, the urbanization that we're experiencing in Kampala. There's a lot of dust. And a lot of people use biomass fuel for cooking. So the triggers may be indoor pollution, like from biomass, maybe cockroaches. By the way, cockroach allergy is one of the triggers for asthma.
The challenge, however, remains that most government health facilities lack essential drugs for treating asthma. Some rely on outdated drugs, which poses a risk to patients, a reason medics want government to prioritize the treatment of asthma by stocking all the necessary drugs in hospitals to save lives.
The patient with asthma should have the reliever or the rescue medicine with them. When they get an attack, they can inhale that medicine a number of times. But if they do not respond, they should realize the signs and come to hospital.
Asthma has several symptoms like difficulty in breathing, cough, wheezing, and strikes at any given time, with patients cautioned to always move with their medication wherever they go, just in case. Stella Nabakoza, WBS TV, Kampala.